Good evening, everyone. Welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and we are talking tonight about celebrating African American physical therapists. So it's Black History Month. Happy Black History Month, Dr. Spears. How are
Happy
you?
Black History Month to you too. I'm doing good. How are you?
Good. We want to talk about our profession tonight, but in a manner that is real, authentic, and one that will be a little bit more insightful in terms of how we view it, how we've experienced it. So we encourage you to pull up, make sure that you are tuning in, you give this a share. But also, if you have a comment, you can always put it in the comment section and we will answer it. But pull up with limbs and things is to confirm something you know, challenge something you don't know, and give you the opportunity to share that information with someone else. So Dr. Spears and I met very interestingly during the pandemic on Instagram. And it's just I think it was like random. Found her page, she found mine, and we've been talking back and forth since then. And
Right.
that, what is that? That's 6 years ago now. Wow.
Really? Oh my goodness. That is.
Yeah. So, and
Wow.
she's also a third of the singing PTs when we do a song at the end of the year.
Yay.
So glad to have you tonight. How are you?
I'm doing great. I'm
Good.
excited to talk and, share our experiences.
Good. Okay, so let's talk a little bit about you and what you do with EJ Hicks. I know that you are a pediatric physical therapist, and I'm a geriatric physical therapist, and we know that pediatrics is really about potential, what the children can potentially do. And then geriatrics is more about like preservation,
Mhm.
dignity, and getting that person back to independence. So, same profession, same fight, different seasons of life.
Right. Right.
Okay. So let's talk about what originally pulled you into physical therapy and what keeps you on the hardest days.
So, what originally pulled me into physical therapy was actually my passion for children with special needs.
Mhm.
And it started since I was a little girl. I was always helping. I wanted to be the helper, helping anybody. I was very curious. I wanted to know more. However, growing up, I've learned I didn't want to be a special education teacher, did not want to teach.
Mhm.
And I knew I didn't want to be a pediatrician. And I was trying to figure out ways like, what other professions are there? I didn't want to be a nurse.
Mhm.
And I wanted a job where I did not sit at a desk. I needed to move my body.
I get it.
So when college came, I started doing some research. I was never exposed to physical therapy. I didn't even know it existed. I didn't know anyone who'd gone through it. I was
Mhm.
one of those students. I went and started doing some research and volunteered at a hospital. And when I got exposed to inpatient rehab and pediatrics, it was like the best of all the worlds combined. Being a part of watching children overcome so many different battles, seeing them at
Yeah.
their hardest, but also watching that testimony happen and the
Mhm.
blessings happen. And being a part of that, I was like, this is the best of everything. And
Yeah.
so that is what sold me. And I was stuck. I was like, nope, this is what I got to do. This is what I want to do. And on my hardest days, what keeps me going, I love the babies. I love the children. When I tell you these kids got me going, they inspire me each and every day. Like kids, I can never be mad at them. I just love the mystery of each day because you never know what you're gonna get as far as children. You really don't.
That's good. That's good. The original pull to physical therapy with me was I was exposed through my dad
Okay.
um, having a physical therapy session when he had a surgery with his knee. And
Mhm.
then watching them go into those sessions. And I was like, I think I can do that. I would like to be able to help somebody go from not being able to do something, having a surgery, and then giving them the opportunity or showing them the steps to get back to
Mhm.
where they were before or even better. And on those hardest days, seeing someone push through, watching them push through kind of
Mhm.
makes you feel like, oh man, life is not so bad. We can all make it. We just got to push through. So I think that's really important because you're saying the same thing, but from a different perspective and a child's view
Mhm.
versus the other end. But really, like I was saying before, it seems like we're saying the same thing, but just in different seasons of life.
Right.
So when did you first realize? I think you mentioned it. Yeah, I belong in this profession. It sounds like you said that after you did that inpatient peds rotation. Is that true?
Yes, I was stuck on becoming a physical therapist despite so many people telling me to do something else. It was interesting. And
Mhm.
I feel like because I was black and because maybe I wasn't a straight A student, I called myself average Joe. I had a good like 3.4. I was always good. It wasn't great. It wasn't low. It was right there where you needed to be for most programs. And
Yeah. Okay.
um but I had difficulties with standardized tests. So GRE was very, but um it's just interesting like I just knew this is what I want to do. I was set on it and I was determined despite what they may have said. I'm like, nope, this happened. And when I tell you God stepped in,
Mhm.
he did. Because I got that call the day before class started. After they told me no, I get a phone call and they said, hey, one of our students had to drop out and you were next on the list. And I'm like, what? I was on the top of the list. I didn't know. And I had to drop everything. And then I left to go the very next day to start PT school. After I had considered changing my careers, but to PTA, I was going to go to PTA school. But God
Hmm.
kind of said, hello, you're going to go and you're going to be a doctor. And I was like, well, hey, I'll take it.
That's awesome. I didn't know that.
Yep.
Okay, so tell us where you went to school.
So for physical therapy, I went to Winston-Salem State University. Oh,
Mhm.
I'm so grateful for them. HBCUs.
Yeah.
Um, because I said they're the one that gave me a chance. And had it not been for, honestly, I think programs that do look to diversify, I
Uh-huh.
don't think I would have had that chance or opportunity. Because on paper, like I said, I blend in and it didn't stick out. And so I technically never received an acceptance letter. I don't have one because I was never accepted
Didn't
into
need one though.
any, and
Got a
but
phone
I
call.
didn't.
Yeah.
Yes, yes, but I love Winston-Salem State. Go Rams!
Okay. Well, I went to Alabama State University. I do have an extreme love for HBCUs,
Yes.
and it is very true. The diversity of having an HBCU, especially though in PT school, because everybody thinks just because you go to an HBCU, the whole class then looks just like it did in undergrad, but that is not true. There
Right.
are a whole lot of people vying for those seats because PT school is very competitive.
Correct.
So it is, like you said, you don't necessarily have to get a call, but once you are in that class and once you are matriculating through that program, it is a very rigorous and challenging situation.
Yes, it
But when
is.
you make it through, when
Right.
you make it through, then you have to pass this national physical therapy exam. And like you mentioned, those standardized tests can be difficult to pass. And
Yes.
so those are things that we have to push through, just like we were talking about with our patients.
Hmm.
Seeing them push through to get to their goals, you have to do the same thing, but from a practical life application aspect to get
Right.
to being a physical therapist. And that's where some of the barriers end up coming from, right?
Right. Correct. Correct. Because there are, when you think about so many, I feel like missed learning disabilities and stuff as my age group, especially our age group
Yeah.
growing up, and you start to discover these things in grad school.
Yeah, that independent learning stuff will show it, right?
Woo, it will expose you. It
Uh-huh.
will expose you. But I will say too, I'm very proud of Winston-Salem State because I'm also adjunct faculty there.
Congratulations.
And y'all, when I tell you, Winston-Salem State probably has the most diverse population of students, and it makes me so happy because I thought we were like one of the most, and we had like five um, Black students in my class out of 28. And so I was like, whoa, because mind you, I'm surrounded by Duke, UNC, and a lot of them they had maybe one
Right.
two within all three of their classes. And so I'm like, we
Wow.
got five in our one class. Like, yeah. But now I look at the class, and when I tell you, it just puts such a big smile on my face that
That's
I
good.
can count. like 10. I can get to 10. And I'm just like, there are 10 of y'all.
Mhm.
And it's just a beautiful thing to
It
see.
is. It makes alumni proud too, because then you feel like, okay, we're continuing the tradition, trying to get more people who look like us in these areas where it's difficult for them to penetrate.
Right.
Okay, so let's talk about when you first noticed that being an African American physical therapist came with a different set of expectations.
Ooh, I would say I actually noticed in PT school,
Mhm.
PT school going on clinical rotations. I had some experiences during clinical rotations where I remember I had a nurse who would not give me the medical records because she thought I was not a student, not a PT student.
But
She
you
did
had a
not.
badge.
I had a badge. It
Mhm.
said it. Had all this stuff going. And my CI, when she was like, "Who's not giving to it?" And I pointed to the lady, and she was just like, she kind of like rolled her eyes and was just like, "Oh, like I know what this is." And so she went and she just snatched the record and got it. And then and that told me in that moment, like, oh, okay, this is,
That's what that
and it's expected when you have to call
was.
doctors sometimes.
Mhm.
Um, I've had some that just will just have at it. And I'm just like, and sometimes it's just from the name first because my name is Jennetta and I'm black. But it's like I naturally with everything else, we're always held to a higher standard just to try to get treated equally. We
Mhm.
have to do above and beyond. And even still, that sometimes is not enough. Um,
Correct.
yeah, it's interesting. Case by
Yeah.
case, not always, but
Yeah.
you have these experiences that will definitely show you.
Absolutely. Yeah. So for me, it was rotations. I think I can call out something at every rotation that happened. Either it was a patient that didn't want to work with
Mhm.
me because of how I looked, or it was a therapist that was discriminatory in saying that things that were done were not at this standard. However, you catch them doing the same thing, but you know you did a better job.
Mhm.
Or there were times when there would just be a higher critique of you, and you're with other students who are also doing their rotation, but you can't say anything. And you have to go in the CPI meeting and you have to advocate for yourself. And sometimes that advocacy then has to raise to the CCC level. And then it just becomes a thing. So there are so many ways that that has occurred at the intern level, but
Mm,
they've been overcome. It was a hard thing to go through at the time.
I bet.
And I think it gave the resilience that you need once you're out there, though. And some of those experiences are like catalysts for what's to happen later.
Right.
Yeah. So those are some things that happen along the way. Now let's talk about when you've had, say, a patient or a colleague that underestimates you and you surprise them by doing a good job.
I feel like that happens often. Um,
Often. Yeah. Often.
ah. Hmm. It's interesting because even though they become surprised, I many times they won't admit it, they won't acknowledge it, and
But you
so,
see
but
it.
yes, yep, it puts a smile on my face. I
Yeah.
feel proud,
Mhm.
because a lot of times people they straight up judge me, and it's just like,
Mhm.
um, and it's tough, but it's like you just gotta stand your ground, do what you do, and let the results speak for yourself.
That's
And
true. Yeah.
that's just what it is. And I've learned, especially as a business owner now, like when I have clients who question if I know what I'm talking about, and start questioning and questioning, I've learned I don't always have to deal with that as well. And I encourage, if I'm not up to what you feel like is your standard, you can go ahead we can find another PT because it for me it's always hard when if I say something and you question it and you don't trust it, so you don't do it, and it's just like, what benefit are we going to get? We're not going to go anywhere. And
No, and
so
then on the inside, it bothers you, and that can
correct.
affect your performance. So yeah, I
Correct. And
totally
so I've learned it's okay to step away and to
mm-hmm.
provide them with other options. And for some
That was
people
so
that is
nice you said that.
yep. And it's just for some people you don't realize you're missing out on who the top dog is in this area. And when the opportunity's gone, it's gone. It's gone. It is, but it's interesting because I've received this from different races, including our race as well. Because
Yeah, now that's that.
mind you, they
Mm-hmm.
see us and they're thinking like, "Oh, she probably they got special treatment. She don't know." When you get your doctorate, you're not a real doctor. You're not this. You're not.
All the things, all the things.
Yep.
Yeah.
Not
Yeah,
realizing it's all coming from
that's
a place.
big too, because I think a lot of people think that this is a black and white thing, and it
Mm-mm,
is not.
mm-mm.
A lot of times you'll have people, and they think it's harmless, but they'll say, "Where did you go to school? How long have you been practicing?"
Mhm.
This sounds like something you've heard before, right? And
Yep.
then they'll say, "Well, have you worked with this case? I mean, this type of situation before?" And then when you say yes, or you prove it, down the line we're working together, that you really were good and that you did get the results that the person was looking for, then there's no more questions. And then they're referring their friends to you. But some of those things you have to push through
Mm-hmm.
at the beginning. And it's a little uneasy,
Oh
but I
yeah.
think you get to the point where you realize my work will speak for me.
Yes.
And
Yep.
then you just let it go.
Yep. Exactly that.
Yeah. So let's talk about, how do people typically respond when you introduce yourself as a doctor of physical therapy?
So it's interesting for me. Uh, I introduce myself sometimes as doctor of physical therapy, and sometimes I don't. For me with pediatrics, it's like I almost sound like I'm introducing myself like I'm a teacher because I'm around children and children are already just intimidated when another adult is coming in there.
Uh-huh.
And I'm like, I'm Miss Net. And so that's who I am, Miss Net. Understanding that many of the kids can't say my name. And I go off of that. However, depending upon different settings, I do apply the doctor title and I will tell them I'm a doctor of physical therapy.
Mm.
Um, and I feel like it's respect. There are different takes depending upon what setting where you're at. It's received different.
That is true.
Um, it is definitely received different, and so it took a while for that title to grow on me because I felt like my year when I was in I graduated 2013. During that, they were instilling in us like, hey, like don't go around calling yourself a doctor kind of thing.
They
Uh,
did that? I came
with
out in
more
2012.
like a doctor of physical therapy, like it's more complete sentence, not doctor so and so, depending upon what's what. But then when you think about it, and we say professors, you think of all the different degrees, and we call them all doctors. And I
Yeah.
think we realize, like, yes, you could say Dr. Jennetta Spears, your physical therapist, and that is
Mm-hmm.
not confusing at all. Just
Oh,
as much as there are eye doctors and dentists and
yeah.
all these different things. And so for me, it took a while to kind of get comfortable with it. But when I first got my doctor, it was interesting how many people that were trying to tell me I was not a real doctor and um like discredit. But then I realized many people that do say that may have not gone to graduate school and may not understand the hierarchy of things. And so I leave it alone. And I'm like, you know what? It's okay. I'm like, that's not my problem. So
Yeah. That's how I feel about it. My degree is my degree. However I introduce myself, that's how I
yep,
should be referred to. And that's it. I do have patients that tend to say, so I come and I say, hi, my name is Dr. Chanel James. It's nice to meet you. What's your name or something like that, right?
Mm-hmm.
Clearly I know who the person is, but still you want the person to give their name. And then someone will inadvertently say, what would you like to be called? And then I'm like, I just told you, but I can't say that. Right? I can't say that. And so then I'll say Dr. James is fine or Dr. Chanel is fine. But the question always comes from a certain group of people. And I find that it's not racially centered. It's
Mm-hmm.
more, sometimes it's cultural. Even though I work with older adults, sometimes it's cultural on where they were born. Like automatic respect is for people who are sometimes in the South, like they were raised in the South. Automatic respect is not for these people that were born up here. It is not. It's different. And I think a lot of people have an issue, but it's on them. Their issue with being able to say Dr. So-and-so is an internal one that I don't even go deep with you about.
Right.
This is what I prefer to be called. Let's just move it along and be addressed like that.
Yep.
The argument that I see online, I'm like, why are we doing that? Why are we wasting our time with that? Okay, so how do you handle it when someone questions your authority without saying it outright? Because everything these days is not overt. Sometimes it's very covert.
When someone questions, I actually kind of respond back with a question usually, so that I can get better understanding and so that we can all get better understanding, in case that I am possibly not communicating correctly. And so when initially I'm like, okay, maybe I didn't say this in the right way and maybe I should use some other words. So I could re-explain something. And then if they still continue to ask questions, and I'll ask them, like, did anything I say, is it concerning? Like, what are your concerns? What's trying to figure out where the root cause of all of this is coming from, what the big picture is. Because sometimes it's not always just someone who's just like kind of beat down. A lot of parents who children gone through so many different procedures, medical care, they become very fragile and they get nervous about a provider coming in, especially if they had like the same provider over a course of years. And you just have to be sensitive to knowing like they are very particular about their child. And I respect people like that because they're being the advocate that they need to be.
Yeah.
But at the same time, it's like we all got to be able to understand and communicate together. And so I try to make sure, hey, it's just not fear and anxiety, or if it's just you don't trust me, or like what it is. And so I ask more questions just so that I can understand the situation better and we can understand the situation better and try to find a common ground.
Yeah, that's a good response. And I think I do that as well. Sometimes I answer it and then I'm seeking more clarification to,
Yes.
Let's dig deeper into that question. But a lot of times, like you're talking about with parents of the children that you're working with, I get the other end where their children are the ones who's caring for them now. And so now we're trying to explain things that they may not know that this is what happens later on in life because they're not there yet. Or they're trying to navigate the system and figure out how they fit at this point in the game. Like the person's out of the hospital. Do we go home and get home health first? Do we see you as a Medicare Part B provider? Who do we set up services with so that we get the best care for this person at home? So a lot of it is education on the part of who's working with that person that they are seeking care for.
Yes. That's interesting. Similar situations, but different caregivers.
Yeah, that's true. That is very true. Okay, so let's see. We talked a little bit about us. Okay, I think this is a good one. It's a heavy one.
Okay.
I think this is a good one. It says, how do you decide when to address discrimination head on versus conserving your energy and moving on?
So I will say I am I am the kind of person that it's hard for me to communicate feelings that are strong. Um, I will definitely say. Fun fact, because I have my diagnosis of autism. And that is something that I've always naturally avoided because I've learned for me personally, there are some things that just send me over the edge. And when I get too emotional, you see it all. You're going to see it. I cry, all of that. And there's certain things that just can't simply talk about. So over the years, I will say life experiences, all of that has prepared me for when it comes to the time and I'm like battling discrimination many times, believe it or not, which is probably not the best way to deal with it, is I just leave it alone. I kind of take a mental note, remember who, what, when, and where, and leave it alone. And the thing is, and for me, it's because I know I have never been at the point where I can address something very passionate that makes me so upset. And I've yet to find a way to express myself while staying down. So therefore I just don't. And I feel like for me that has been my better option, to leave it. And I usually try not to avoid. However, because the medical community is so small, you're going to find yourself seeing these folks again. But for me, I've naturally, I don't hold on to things. And for me, I'm always, it's patient first when it comes to interactions, whatever the case may be. And when it comes to like families, I'm still looking at the child. For me, the child is innocent. And I will work and do whatever as please. And if they feel uncomfortable or whatever the case may be, they get the speech of, hey, so there are other places. and that's how it is. And for me, that's the best part of working for yourself, because I don't have that pressure to be like, we're going to push through to make this. And it's just like, no, in today's time, I don't have the space and energy for this. We're going to keep it moving. And I'm going to stay in a positive headspace.
I got you.
How about you?
Both. I feel like there have been situations, probably when I was in internships, where there were issues and I felt like I would take it to the higher supervisor. And if it wasn't resolved there, then it kind of didn't go anywhere for me. But then there were some cases when it was the patient, like those are the things when it was people or coworkers you were working with, right? You try to go the hierarchy path. When it's patients directly, like I've had people, as hard as this is to say, I've had people spit on me, right? And I've had people do things that were just that's like a higher level of almost like civil rights type of responding. And it was, thank God, there was full, the stuff you have to put on PPE.
Yep, PPE.
Yes. Okay, but it was not, it was a face shield and it was the garb. And the person had like MRSA or something like that. And it took everything. It took everything. But I had to say it. I had to say it in that moment because it was not going to be rectified if I didn't address it.
Yes.
So I had to say, this is not how this is going to go. And if this is the way you want to treat people, I won't be in it. And so that person ended up having to be treated by somebody else. But there are situations where we are now at a point where you can see and choose who you would like to see. And those things give you a little bit more freedom. However, it's not to say that you won't encounter it again.
Correct.
But in that sense, I feel more empowered to say, that's not a comment that I would like for you to repeat again. Or things of that nature. And sometimes it's the comment, sometimes it's the behavior. If it's the behavior, but the person has a diagnosis of like Alzheimer's or something, I let it go.
Right.
But the people who are lucid, they have a higher They have a higher standard to uphold. So
Yes,
yeah.
yes, yes. Very true, very true. I used to spend a lot of time. Well, it's funny, when I was a tech, they used to call me over because I was really good at persuading the elderly to participate in therapy. I had a
Okay.
really good thing that I could do. And I'm one, when I work with elderly, if they have dementia, TBI, give me all of the different cognitive stuff, because
Mhm.
one thing about me, I don't take nothing personal when I'm interacting with them. And so I'll go
You kind of
in.
gotta have a lot of tough skin.
Yeah, oh yeah, girl. It, to me, it just go in one ear and out the other. I just have
Mhm.
random conversation, and that I could always do. But for the ones, like you said, that understand, I always had a hard time with them. That's
Mhm.
why I couldn't do geriatrics, because it was hard for me to tell an older woman what to do, because
Uh-huh.
she felt like she could check me, and in my mind she could, because
Mhm. She was
she
over
was an
there.
older woman. She's my elder.
Mhm.
Yeah, I can, I'm too soft.
But it'll make you grow a spine. It will. Because some things you just won't take.
Yes,
Everybody
yes,
has a limit. Yeah.
yes, yes.
So let's talk about what advice we would give to younger Black or African American physical therapists encountering what we call now as microaggressions for the first time.
Mm. So I will say, it depends on the situation.
Mm-hmm.
I had a mentee that had things that were happening, and she came to me and we talked about it. And she had like 3 weeks left, 2 weeks left. And I told her, and I said, I know you're upset in this moment. You're so upset in this moment. You have every right to be upset. But I want to remind you, this is temporary. This moment is temporary. And that your response matters on how to move forward with this, because
Mm-hmm.
you're almost about to graduate. This is almost done. I said, and you will leave this clinical site. You will leave this place. You don't have to go back to that place. I said, so I was like, in this moment, I said, just be wise on how you want to address, because you're right there. You're right there. Um, and I wanted her to say something, yes, to the
Okay.
right people.
Uh,
So that she can finish. And that's it. I said, you want to finish. I said, this, you want to finish. I said, it's bad. And I know you want it. I said, but you're right there and you want to finish. When
mm-hmm.
it happens in school, remind yourself, this is temporary. You're going to finish. You are going to finish. So be wise with how you handle the situation. Take it to somebody else. Go through proper protocols, go through the proper chains.
Mm-hmm.
Don't put it in your hands and go. But also to say that too, when it comes to, it's similar to when you're working for someone else as well.
Mm-hmm.
Things happen, and yes, if you start to feel uncomfortable and unsafe, whatever the case may be, do what you need to do in that moment, or remove yourself, and then go immediately talk to your manager, your boss, supervisor, whoever the case may be, and keep people informed. The more communication, the better. Written communication, the better. Emails, just keep everyone informed. Write it down. Write it down, because if you didn't write it down, it didn't happen. Put
That's
it in
true.
them notes.
Mm-hmm.
Support yourself. And then if it's your coworker, like I said, go through those proper chains, because one thing about it is it keeps you covered if you go through proper chains. If you try to address it too much and get all in your feelings right then and there, it could cost you your job that you might love. And so don't let somebody else determine your future at your employment if you enjoy it.
Mm-hmm.
Go through the proper chains. That's my best advice.
That was good. That was good. I agree. I did not take that advice at one point. And I won't say that it cost me, but it probably sacrificed a closer relationship.
Mm.
And not that it needed to be as close as it is now or lack thereof. However, to me, in the what occurred needed to be addressed. And so I addressed it with I skipped the train and went straight to the person. And I think it backfired negatively. However, not so much that it was detrimental.
Right.
But I do agree that you should definitely go through the proper chain. So there is an example of the way you should go and the way I went. So yeah, I think sometimes as a younger PT, we often think that once we get to a certain level, we can just fly,
Wow.
right? And that doesn't work like that. A
Mm-mm.
lot of people will make you have to prove yourself,
Mhm.
especially when you come out and you're working for someone else. And then it's good to learn from other people, other seasoned PTs, just in types of techniques to use, but also how to deal with people because these personalities, you don't get those in PT school. You're working with so many different people. Their anatomy is different. What you see on a cadaver is not who you see out here.
Right.
And it may be in the general spot, but it is not exactly where you anticipate it to be just from textbooks. So it's important to have the experience first. Sometimes, like I was told initially going into entrepreneurship, because I wanted to do it right out of school.
Mhm.
And I was told you need to work first. You need to get under someone who has done this before and learn from me. And you need at least 5 years. All right. So I semi listened to that advice. I was also told not to do travel PT immediately after school. But now, when I mentor people, I say, take the job that you want to take. I thought that travel PT was very advantageous for me because I didn't really know which setting I wanted to work in.
Mhm.
So, being able to bounce around and go to different places helped me to develop
Right.
a wide variety to know exactly which one I wanted to do, which one felt like the best lane for me. But if I didn't have those experiences, if I didn't go into travel therapy, I wouldn't know. So
Right.
don't always take that one person's view as the gospel. Try to get a
Right.
well rounded piece of advice from people and having mentors in different
Yep.
settings, mentors that will tell you their experience, but also give you a little room to make your own errors. Because
Mhm.
sometimes we learn best from failing first. So
Yes. Yes.
that would be my suggestion. Okay, so we're talking about organizations. What organizations or communities have helped you feel less alone in this profession?
I will say shout out to the NABPT
Mhm.
because during the same time where I met you, I found out about the NABPT. And so I'm like, what is this? I'm like, there's more people like me. And it was just such a beautiful thing to know and to see it,
Mhm.
because seeing so many, when I went to my first CSM, and I went to the they had like a social, and walking in, and I'm like, look at all these black people. I'm like, we're all the same. I'm like, we're everybody's PT and physical therapy.
Uh-huh.
It was an unexplainable feeling, I will say. But just having that community, and I was a part of their mentorship committee, where we had, for a while, we had a good program kind of going, and we were assigning mentors and mentees, and I mentored a couple, I want to say like three different people.
Mhm.
And it's just that giving back, recognizing what I didn't have in school, what I wish I had, and trying to give that as well to those students that are currently in school.
Yeah,
But also recognizing it's nice to have like your support and people who are also were along the journey, even though they're different, but we're all entrepreneurs trying to get this, figure out all these things. Like, the support is there and the comfort of communication is there.
absolutely.
Because for me, as like, especially in the beginning, I remember I felt like I kept messaging you, asking you questions because there was a level of comfort there
I remember.
versus trying to go to someone else and you feel like you have to impress. Like I always felt like I can't just go to someone so because then they're gonna think less than of me. Like, why are you asking me? But it's like for some reason we naturally just feel okay with our own people.
Sure.
You can be your authentic self and ask these questions and get to the root of everything versus trying to hide, which I notice I do that a lot. I hide a lot. I am a part of the APTA. However, my goal, I want to say next year is to at least try to participate a little bit more, or at least go to the conferences because I've always been nervous to go around because I shrink. I've naturally shrink. Every time I go, I feel so intimidated. Seeing the khaki pants and all of the polo shirts, and I'm like, whoo, okay.
Yeah.
But I'm learning, like NABPT has helped build. It has helped me learn my creative style, allowed me to present, made me see like, hey, you're doing all right. Like you're
Yeah.
doing fine. Why are you so intimidated? Like you're okay.
Good. Good. Yes. Okay. So in undergrad, I was introduced to the American Academy of Physical Therapy through Dr. Linda Woodruff. And I was her intern and doing like all the booklets and stuff for this conference. And she would make sure that we attended and stayed in the conference hotel and all that. And checking people in and seeing all of these pioneers of physical therapy. And now to have had the experience to have been the secretary of that organization, as well as being able to create some of the conferences for virtual spaces as well as in person. Those things have taught me a lot about having mentors as well as the community of seeing physical therapists, but in different generations. And being able to hear their experience. It's kind of like what we're talking now. Having heard their experience from the APTA side and how APT was created from lack of a voice from that, and being able to establish scholarships and be able to give physical therapists who are up and coming the opportunity to present like you had it in ABPT, as well as giving them the opportunity to be mentored and succeed in areas of the exam where you know that there's some challenges, where you know that there's challenges in admissions to physical therapy schools. So all of those things, as well as like facilitating some Zoom conferences with kids who are currently or students who are currently in PT school, but they're finding that they're in PWIs and they don't have the support there. So those are ways that I found that those types of communities are still prevalent. They're needed.
Yes.
They are so needed on many different levels, but there's kind of a divide in being able to make sure that people are tapping into them, because I'm not sure if it's being broadcasted on all of these campuses where people have PT schools. True. And then people lose the community, like they're starting ones at their schools, but then they only have themselves. They don't have a hierarchy there that can help support them as they matriculate through the programs. So I think it's the onus is kind of on us in our generation to go back, especially as we become adjunct professors, or as we become these people who are now the older generation of physical therapists. So we definitely want to reach back and help and bring people up, because there are so many people leaving physical therapy now.
True.
And we want to be able to at least keep those who are here and know that, you know, you can get to physical therapy school without getting in so much debt. You can get into physical therapy school and find that, you know, as you get out, you don't have to stay in the same lane. Like I dipped into peds during the pandemic. I've been in neuro settings. You can go into outpatient. You can go into sports. I mean, there's so many different veins of physical therapy that it feels like you can switch professions.
You can switch. I know. I always try to teach people like you can switch. You don't have to feel locked in to whatever. I see adults because I'm like, children eventually they're going to be adults, and I realize they are the missed people because they try to go to orthopedic or outpatient PT, and they're like, they have cerebral palsy, we don't know what to do. And it's just like,
Mm-hmm.
come see me because I know what to do. So and it's just interesting because you just have those different perspectives.
Mm-hmm. Mm-hmm.
That's why I love PT. There's so many different ways you can just kind of go and do so
Yeah,
many
and that
schedules.
plays a big factor in the fact that people are different.
Hmm.
Everybody cannot be cookie cutter or dressed.
Right.
You have to be able to tailor it to people for them to meet the goals that you're setting. Yeah. Okay, so what does rising above look like? That's not the Instagram version.
That's not the Instagram version. Rising
Mhm.
above. So, mm,
A lot of people will tell us, "Oh, you
mhm.
just have to rise above that." You know.
I would say, I would say I think when you sit back and you realize all that you have put into this, the fact that we went through schooling, we got licensed, we've done all these different things, you realize that there are situations that would need to be addressed, and then there are situations that are not worth your time
Right.
because you have
Mhm.
gone through so much to get to where you are. And I think sometimes we forget where we are. Because honestly, there are lots of reminders where people really try to downplay who we are.
Mhm.
And it's just trying to remember where you came from, what you did to get here, and that you're actually here. Like we're
Yeah.
here now. And so uh there you can actually evaluate, okay, is this really worth my time, or do I just it's just fine. It's whatever.
Mhm.
However, like I said, there are situations where that have to be addressed. You just got to figure out ways to get through, and as you say, push through, because
Mhm.
we got to keep it going. That's the
Yeah.
thing. We still got to go back to work the next day. We still got to do things. We still got to exist. We got
Yeah.
to, and one thing about it is we do a lot of multiple hat wearings. Like most of us were moms, wives. We have a lot of things going, happening.
Mhm. Yeah.
We can't get too caught up on certain things when we have all this stuff going on and that we're playing all these different roles.
Yeah.
And so it allows me, me and my husband, we're both like, we go to work, and he's like, I go to work, I'll deal with the people, and I come back home. And I was like, yes.
Mhm. I
And
do. I think you have to be wise in
mhm,
choosing what's worth your time.
mhm,
And you also have to, it's like a catch 22. We all have to stand up for ourselves. Like we don't just want to be walked on. However, we have to pick and choose our battles. Is
right.
it really going to be worth it in the long run
Long run,
for us to
yes.
address this? Or is it worth us just washing our hands of the situation?
Yes, correct.
Yeah. So, but sometimes it's hard for people to decipher. And then you have to, in my opinion, ask the Lord for discernment to figure out which one you need to address because everything don't deserve your time.
Look, God plays a role every day. And
Yeah.
when I tell you, I thank the Lord for him,
Yeah.
because he truly is the way for me to
Absolutely.
manage.
Hmm. Okay, so let's talk about something that excites you about the future of African American physical therapists in healthcare.
What excites me is that there are more. I am seeing them as being PT students. I'm seeing there's more interest. With there
Mhm.
being more interest, that means there's going to be more awareness of different things. Because mind you, when
Okay.
I was in school, I didn't know anything about physical therapy. And so there's going to be more awareness. And with all the knowledge that we know, and that's the part that people don't even realize, all the different things,
Yeah.
we don't just walk people. There's
Wow.
so much stuff that we know and do.
Yeah.
We're able to help our different generations. Like,
Mhm.
I can talk to grandma, auntie, uncle, even though, we go through that battle as well, for them to actually hear us first. But eventually they're going to hear us. But
Uh-huh.
we have our church communities. We have different community of people who aren't aware of certain things.
Uh-huh.
And as we navigate, it's important that we also help bring up and build up those that are behind us so that we are passing along this information, things that
Yeah.
we know. How can I help? What will help with my knee pain and all of these different things? Or my child, he's toe walking and this and that. All these different things are happening. Understanding that getting it addressed, taking away the stigma about like a diagnosis or the different concerns, and understanding that a diagnosis actually allows your child to receive assistance.
Mm-hmm.
It's the part that breaks so that you can actually get these resources. Without it, we just can't say, oh, he just gets upset every so often. As long as you bring his blanket and da 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 da. Teachers can't do nothing with that unless there is
There's
a
a diagnosis.
official reason.
Yeah.
And so we have to, the more informed we get, the more we share and educate. And I think it helps us with longevity. It helps our communities. To just to see it is beautiful. And it's good because it's going to take that. The comfort. I saw an older gentleman for wheelchair evaluation. When I
Uh-huh.
walked in, he flipped out because I was Black and he was so happy. He was like,
Yeah.
oh
Oh,
my
we
God,
should address that.
oh my God, I didn't know. I was like, I was just sitting there cheesing. He was like, what
Yeah.
school you go to?
Yeah.
This is so nice. And I mean, him and his wife came and she was just as big. I felt like the trophy. I wasn't even their
Mhm.
grandchild, but I felt like in that moment, I felt like I was kin. And
Yes.
it's like the best feeling ever. But that we're looking for this because we need to help each other. We gotta help spread just like the comfort I get when I talk to you, ask for advice, there's a comfort there as well when it comes to
Yeah.
medical advice.
It's true. And that feeling is mutual. You know, we see it from the patient perspective, but on the inside there's a huge smile in us too, because it's like, yes, we get to treat you too. And we're gonna take real good care of you, just like we do
Right?
everybody else. But there's something about you and me that's a little bit kindred, and the fact that you look like me.
Yes,
So
yes.
there, um, that is very real. For me, in terms of the future of physical therapists in healthcare, I'm excited to see a lot of people building businesses of their own. I think that it is very important that whatever sector of the country you live in, you build whatever you can, because there's somebody there who will have that same response if you come and see them. There's somebody there who is not getting access to care. And like in our cases, we're mobile providers. And
Mhm.
so people who probably wouldn't get the care at their home anymore would receive it because we opened up our businesses in this area,
Right.
you know? So I think, like you mentioned, also education is highly important. And there are so many areas where we can filter that bigger corporations cannot, and
Right.
there would be people who would be more interested and more susceptible to being able to understand the information better, because how we're conveying it is in a manner that they understand. And
Yes.
so it is important to me that there are more African American physical therapists that are coming along and that are starting their own practices, so that there can be a continuation. And there are a lot of people who are doing cash versus insurance
Mhm.
based therapy, but I think access to care, especially with social media, people are seeing all of the options available to them, and then they can make their own choice.
Right.
A lot of times we think that insurance is a limiting factor. However, you can choose
Mhm.
what you would like to do. The goal is for you to get to independence in our eyes. And so if you want to be able to do it, you'll take the necessary steps. It's just like any other thing. If you get, say, 3 bids on something, sometimes you take the lower ball, but sometimes you take the one that you feel is going to get you to the result the
The
best.
result. Yep.
Yeah.
Mhm.
So let's end and let's talk about, let's see. What would you like somebody to say about you as you retire as an African American physical therapist?
If I retire,
Hmm.
what would I want them to say about me?
Hmm.
Ooh. Is
A
this
lot of
like
us think
bragging
we
on
never
myself?
retire, but physical therapists got to stop too.
Yes. I feel like I'm gonna brag on myself. What I wish people would say about me
Yeah.
is that I was a great listener and a hard worker, and that I had a natural gift with the babies, and I truly enjoyed what I did.
Hmm.
And even like I hope that I inspire other PTs to, branch out and start your business or businesses,
Hmm.
or if you have an idea, go after it, because you could be helping uh whoever. If you help one person, it's a blessing. So
Right.
I just hope that I feel like they feel like my life was fulfilled, and I know I'm gonna hopefully feel like I've been fulfilled being a PT, physical therapist, because
Yeah.
I love everything about what I do except the documentation. But I love it, and it doesn't feel like work when I'm working. And
Same. Same.
I hope I keep that feeling. And when if that feeling starts to go away, that's probably my cue.
Yeah.
But
For real.
it's yeah, I hope they see that I loved what I did. Yes.
Hmm. I agree. I think, the Limbs and Things slogan is moving from I can't to I can. And I think if I can help somebody move from whatever they can't do to being able to do it, then it was worth my being your physical therapist. But the the education and the impact that you want to have on someone is that they can see their own potential. I think a
Mhm.
lot of times people, especially as they get older, they think, oh, because I'm old, I can't do this. And that is not true. It is because you're not moving that you are feeling any type of way other than a diagnosis that is leading to that cause. However, the lack of movement will beget pain and beget stiffness and have you to sit down instead of moving. So
Right.
the importance of moving is highly important in terms of your longevity
Mhm.
and being able to socialize with other people. I think a lot of us underestimate, especially in the older adult population, the power of social media and
Mm.
or the power of talking to somebody. Now we good talking on the phone, right? A lot of us like getting on the phone with someone. But there are other ways that you can communicate with people, especially those who are long lost to you or you feel like you have not seen them in a while. You may be able to do so if you find them on social media. But the other thing that I think people need to know
Mhm.
as you retire or as we retire is what physical therapy can really do. There's so many times that we're having to explain what we do. Like you mentioned today, we don't just walk you, right? We are not dog walkers at all or people walkers. Our whole goal is to see how well you are moving on your frame and
Mhm.
what you have to do to be able to move and to have the flexibility and the mobility that you need to be successful doing whatever it is that you want to be able to do. And so, if physical therapy can get you there, you should see a physical therapist.
Yes.
So, okay, I want to thank you so much for coming and talking about this very important topic in Black History Month.
Mhm.
But we hope that what we have said tonight has been something that inspires the next generation of physical therapists, but also encourages people who are looking at us as possible role models. And that's weird for us to say because we still think we're young. But the
Yes.
fact that we're able to be able to sit here and talk to you about this, we probably didn't think we could do that like 10, 20 years ago. We were going
Right.
through PT school or something like that because it was so difficult. But it's not to say that it can't be done. It's something to say about perseverance and resilience through difficult
Mhm.
situations. So, would you like to have a final thought?
My final thought is, let's see. First, thank you for having me on for Black History Month for this first
Thank you for
week,
coming.
and happy Black History Month. And I just want to say to the parents out there, if you question when it comes to your child's development, if you have a question regarding it, have a concern about their mobility, if they're not moving, if they're not crawling, rolling, walking, go ahead and ask your pediatrician. But guess what? You can also contact a physical therapist directly. You can
Mhm.
contact a physical therapist directly, and it's okay to get an evaluation done. Because what's the worst that can happen? That they're actually doing well. And so go ahead and get the evaluation done if you have concerns. If you're unsure and you're just like, I feel like, but I'm not sure, go ahead and get an evaluation done, and we will help talk and navigate, educate, and do all that we can to get your baby or child, toddler, where they need to go. And I say that as a Black physical therapist, a Black mom, because so many of us, we have questions, but we don't want to wait till they're 4 or 5. Let's go ahead and do this while they're early on. Early is
Uh-huh.
better. Early intervention matters. Please know that.
Absolutely. And tell us in North Carolina where we can find you.
Oh, yes. You can find me. So I'm Jay Spears Therapy and Wellness. I have a mobile PT practice in Clayton, North Carolina. I visit Raleigh, Smithfield, Knightdale, Zebulon areas around North Carolina. And then I also have EJ Kicks, which is an adaptive shoe brand where I created a shoe that fits AFO braces, SMO braces. We have kid sizes right now, and we're actually in the process of creating our nonprofit where we will be providing free shoes and adaptive equipment to individuals. So we moving, we moving.
Awesome. Awesome. Congratulations. Okay,
Thanks.
so tell us this way to connect with you. Say it out loud in case somebody is listening.
Yes. So if you have any questions or you want to just connect with me, you can email me at PEDSHHT at jspears.com because it stands for Pediatric Home Health Physical Therapy.
Okay, I thank you so much, Dr. Spears. And as always, if you are interested in physical therapy services for the older adult in your life and you're in the DC, Maryland, or Virginia area, you can contact LimbsNThings at limbsnthings.com or 202-643-2636. As always, pull up with Limbs and Things is to confirm something you know, challenge something you don't know, and give you the opportunity to share it with someone else. Happy Black History Month. Have a
Happy
good night.
History Month.
Thank you, Dr. Spears. Take care.